Thank you, Bank of Canton, for hosting us today. We really appreciate this. So, good morning. My name is Stephanie Patton, and on behalf of the Avon Coalition for Every Student, the Braintree Community Partnership on Substance Use, the Needham Public Health Division, and the Stoughton Oasis Coalition, we are excited to welcome you here today for the Impacts of Marijuana Conference. We're collaborating together, these four coalitions, to bring you this fabulous prevention training on the local impacts of marijuana. So today what we're hoping to do is to bring you the latest science, share some best practices that are practical, some strategies, answer your questions, address myths and misperception, and share some great factual information that you can use back in your communities at home. So before I go any further, I do want to thank again the Bank of Canton for hosting us, and my fabulous planning team, Amanda Decker and Ali Zajac, I don't know if I mispronounce that, from Avon, Lynn Frano from Braintree, Carol Reed from Needham, and Jessica Kuhn from Stoughton. And a shout out to the Norwood Cable Access folks who are filming us today, and Peppercorns Cafe in Stoughton who brought you this fabulous breakfast and what is going to be an amazing lunch. So as prevention coalitions, our goal today is really ultimately about reducing youth marijuana use. And we're going to spend the morning really sharing with you the latest science on why that's important, some really important information about the developing adolescent brain and the impact of marijuana on our communities and our families. And then we're going to spend the afternoon giving you some tools to do it. And it's really just that simple. That's our plan for today. So even though it sounds simple here in the room, we know outside of this room things are actually really not that simple. We have new laws in our state that seem to be changing every day, laws that are sort of like as clear as mud, I feel like. Those of us who are doing this work day to day are often accused of promoting reefer madness and sometimes worse. Some of you I know have been on the front lines advocating for the health of your communities, your children, your families, and we know that sometimes people are really passionate about this issue and not always rational, and so sometimes the arguments and the discussions we get into people can be really difficult, and that can be concerning. So I know that a lot of us in this room are struggling with that day to day. But there is hope, and what I think is clear among those of us here in the room is that what we are for is for the best futures of our children. We are for science, and youth marijuana use continues to be against the law in Massachusetts, so we have that in our favor. We need good public health policy and science to reinforce this. We need to use science and best practices and not be pushed by industry interests and profit. So for me, what adults do responsibly with marijuana, it's not in my professional purview. I'm a prevention specialist. I work to do substance abuse prevention with young people. And that's my professional mission and the mission of my coalition in Stoughton. So it's really, for me, this is about delaying youth use, preventing youth use. And as I stated earlier, that's really our ultimate goal for today and our emphasis. So prevention science tells us that if we reduce youth access and availability to alcohol and other drugs, including marijuana, we can reduce youth use of these things. We can do that through policy, through enforcement, through fostering healthy community norms, and through reducing misperceptions that young people have about use and their peers' use. So here's how we're going to do this today. We started our day with breakfast. Hopefully you all were able to partake. That will be out there for a while, so if people need coffee refills, there's a ton of food. Please help yourselves as you need to. There will also be water throughout the day in the lobby, so if folks need that as well, please help yourselves. Hopefully you had a chance to do some networking, connecting with some of your peers and friends. We have a photo voice gallery out in the lobby, so if you didn't see that yet, make sure you get to check that out at lunch or when you're getting your coffee refills. So we're hoping that those images raised questions for you, maybe got you fired up, connected with some personal experiences that you had, and you'll be able to bring some of those questions back into this room. This morning we have three amazing presenters who are we're going to start with in just a moment. We have Dr. Amy Turncliff here, and she's going to talk about the science behind how marijuana impacts the adolescent brain. We have Chief Carmichael from the Walpole Police Department, who's going to talk with you about what marijuana really looks like today in Massachusetts. And we have Jody Hensley, who's going to share some of the community impacts of marijuana and the implications of some of the new laws. And then we're going to have a really fabulous lunch. And after lunch, we have three attorneys who are here to talk to you about some strategies. We have attorney Cheryl Savara, who will talk about strategies that boards of health can adopt and what you can do with your boards of health in your communities. We have attorney Catherine Laughlin from KP Law, who's going to talk about municipal strategies, opting out, limiting dispensary zoning, restricting any questions that you have about what the law means for any of those kinds of things. And then we have attorney John Shecht, who's going to share some enforcement strategies, how police departments and communities can really think about managing issues in their communities under the new laws. So in order to maximize our time together, we're actually going to hold questions both in the morning and the afternoon till the end of each of those sessions, and we have index cards. If you don't have one yet, flag us down. So what we'd like to do is, at the end of the morning, we're going to bring our well actually I know two Carmike wants to go, so we're going to bring our two of our panelists back up to answer questions. And so if you have a question for a speaker, please write it down on an index card, and we'll collect them periodically, and we will have plenty of time to do Q&A. We're going to do the same thing in the afternoon with our speakers. That kind of keeps things moving for us, and it prevents duplication. And you have time, obviously, at lunch to interact with folks as well. A few other important logistics. We're planning a break for lunch about noontime. As I said, water will be available in the lobby. Please take breaks as you need them. If you need to step out and take a phone call and stuff, I know some of you are not able to shut off your devices today, but if you could silence things, that would really be great. We are filming, just so folks are aware of that, so we can make some of these presentations available to you and your communities later on. And we're going to make all of the PowerPoints and any other relevant documents available to you through Google Drive. The link to that is at the bottom of your agenda. So we'll keep track if there are other pieces of information you feel like would be helpful to you in that drive throughout the day. Those are things we can add as well. So in a way, an effort to save trees, we're using the Google Drive. So before we get started, I'm going to give you all a chance, just so we can see who's in the room. So please stand up if you identify as a prevention professional. I know there's some of you here. You're like a coalition leader, right? You work in the field of prevention. Awesome. Great. Okay. Please stand up if you identify as somebody from a board of health or you represent a public health department. Wow, there are a lot of you. Excellent. Okay. Please stand up if you represent a police department or public safety, fire department. Awesome. Great. All of our law enforcement folks in the room. What about education? Anybody here representing education schools? Terrific. Great. The medical community, mental health, physical health. Great. Thank you. State or local government. All right. Excellent. Anybody planning, zoning specifically? Awesome. All right. Excellent. And I know I missed a few folks, but hopefully you'll get to all talk to each other at lunch and introduce yourselves. So without further ado, we're going to get started. I'm going to introduce Dr. Turncliff and turn this microphone over to her. If you people have questions or other things or need anything throughout the day, please flag down. If the planning committee could stand up. So Carol and Jess and Lynn down here, I think Allie and Amanda are out in the lobby. If you need anything, please just find one of us. We're happy to help you. So, to introduce Dr. Turncliff, in 2003, Amy obtained a PhD in neurobiology from the University of North Carolina at Chapel Hill, followed by 2 years of postdoctoral training with Dr. Bertha Mattress at the Harvard Medical School, where she studied the molecular mechanisms associated with dopamine receptor activation by drugs of abuse. Try to say that fast. In 2005, Amy began her professional career as an analyst specializing in central nervous system disorders, specifically pain and psychiatric conditions involving mental illness and addiction. Since 2010, she has volunteered her time at the local, regional, and state level advocating for youth substance abuse prevention and behavioral health promotion. Please help us welcome Dr. Amy Turncliff.
Thank you to the organizing committee and to all of you for being here today. As Stephanie just said, I now spend a tremendous amount of my time advocating for sound public health policy, specifically related to behavioral health promotion and substance abuse prevention. So today I'm going to start off by kind of talking about what's going on based on the data available in Colorado at the local level in terms of youth use, and then I'm going to move into why does it matter if youth use marijuana, specifically THC, talk a little bit about the components of marijuana, THC and CBD, and then talk about THC and the effects on the brain based on the current scientific literature. When I say current, I mean 2018 studies that don't often make it into kind of the media very quickly. So as I mentioned, I'm going to start off with the impact of marijuana commercialization in Colorado. So the Colorado does a youth risk behavior survey at the state level, where they survey students across the state and ask about risky behaviors. And in particular, they focused on marijuana and put out an information sheet around that. In 2013 and then again in 2015. 2017 data are not yet available, so we are eagerly awaiting those results. But based on 2015 data and an analysis done by Dr. Christian Thurstone in Colorado, who is an adolescent addiction medicine specialist, and he works in a clinic, sees patients, sees adolescents who have substance use disorders. He has told us that where there is commercialization or high rates of commercialization of marijuana, there is the highest youth use rates in Colorado. So there's an association there. We won't know until we have data over time how that's changing with increasing commercialization and the different types of licenses and businesses. But it looks maybe a little blurry there, but in dark purple, these are regions in the state of Colorado that have the highest rates of youth use. Over 30% of their high school students reporting that they had used marijuana in the past 30 days. And then this is in 2015, and it was the marijuana shop locator put out by the national organization NORML. And just a very rough overlay shows that those communities that have what we might call commercial marijuana friendly policies, they welcome the marijuana industry, have high rates of commercialization, have the highest youth use rates in that state, and actually, quite frankly, in the nation. So, Dr. Christian Thurstone, after he did this analysis, and others have done similar analyses, said a common theme among these regions with higher youth marijuana use is a high level of marijuana commercialization in the forms of retail and medical stores. I just feel like that's a really important quote for us all to remember as we here in Massachusetts, start to see commercialization build in communities. So there are three big contributors to youth substance use. And it's increased availability of substances, and I think Stephanie touched on this in the very beginning. Perceived harm, so a reduction in the perception of risk or harm increases youth substance use. And then social norms, which might be kind of the cultural acceptability of the use of substances. And this is across the board, regardless of what substance we're talking about. So just to kind of summarize that, what prevention science says and why marijuana commercialization might be associated with higher rates of youth use. Where you have higher rates of commercialization, you just have more product in the community. So you have an increase in access and availability. That may or may not be youth walking into a shop and purchasing with or without a fake ID, right? Because only those who are 21 and older are supposed to be able to buy this. But there's an increased risk of diversion of product, right? Just with, like with alcohol, people can walk in, who are of age, can walk in, purchase product, and then come out and sell that to youth. So there's just more available in the community. So youth still access product via the illegal market, so that the illegal market doesn't go away based on what we know from states that have legalized, and then commercialization brings more product and more high potency products that are appealing to youth, and I think Chief Carmichael will touch on that. And then, as I mentioned, decreased perception of harm, because if a community is allowing commercial products into their community, that kind of sends a message that the community thinks these are okay. And then decreased perception of disapproval, again, letting youth know that use is okay. And all of that contributes to the cultural normalization of marijuana use. So why does it matter if adolescents use marijuana? And I think people have varying opinions on this. Some people I've recently heard a lot about, it's harmless, it's a plant, it's no big deal. I used when I was a kid. As you know, I'll touch on a little bit, but Chief Carmichael will say, the products that we're seeing with commercialization are not low potency, chill out, marijuana of previous decades, shall we say. So first, a little bit about the adolescent brain. And the maturation of the human brain occurs over time with rapid development of the brain, starting very early. Little ones are sponges. They're connected. They have a lot of neurons in the brain, a lot of signaling happening, and then over time, there's kind of an efficiency that happens, right? Those connections that are being used are those that are kept. And so the brain undergoes a considerable amount of development during the teen years. So this is kind of brain maturation over time. So it starts at about, what's shown here is 4 years of age to 21 years of age. And the brain develops from the back to the front. So the blue is maturation. So this is kind of back to the front. The last area to develop and to mature is the prefrontal cortex. And the prefrontal cortex is extremely important for what we would call executive functioning. For anyone who works in education, that's I'm sure all about that. And it's involved in planning, decision making, and impulse control, which are all really important. And you'll hear a lot of people say, well, teens aren't supposed to make good choices. They are capable. Their brain's not fully developed. Well, I think that is a disservice to say that, because they are in the process of training their brain how to make good choices, right? So as I said, those connections that are being used are the ones that will be maintained. And so it's a really great opportunity for them to practice making good choices. And quite frankly, most youth do make good choices. So in adolescence, the reward system is particularly active in the teen brain. And the centers for logic and reasoning are still developing. That's the prefrontal cortex, as I just mentioned, which is now thought to not be fully developed until about the age of 25. And the adolescent brains are building superhighways for pathways used regularly. So as I mentioned, those kind of circuits that are being used are the ones that are kept, and others are what we call pruned away. So they're not needed, they kind of go away. So I'm going to kind of merge now the endocannabinoid system, which is our endogenous cannabinoid system. So when we talk about marijuana, and specifically THC and other components of the marijuana plant, they interact with our endogenous cannabinoid system. So we have natural neurotransmitters that serve a role and a function in our brain, and that's what the components of marijuana interact with. So the endocannabinoid system impacts brain connectivity. I'm going to walk a little bit through that. So the endocannabinoid system, or endogenous cannabinoid system, shapes adolescent brain development. So as you can imagine, that is extremely important. It guides neurons to grow to the right places in the brain for the correct function, and controls neuronal activity, and as I mentioned, thereby affecting brain wiring. So the neurons that fire together, wire together is a common neuroscience kind of phrase. And they support myelin. The endogenous cannabinoid system supports myelin growth on neurons, and myelin is extremely important for efficient and effective signaling between brain cells or neurons. So before I kind of go into how marijuana interacts with our endogenous cannabinoid system and might impact adolescent brain development, I just wanted to touch on, because I think it's extremely important, I don't love using the word marijuana, because marijuana is the plant itself contains a whole array of cannabinoid molecules. So over 60, some say over 100 cannabinoid molecules in the marijuana plant. The two that we know the most about is THC, or delta-9 tetrahydrocannabinol, and CBD, cannabidiol. So I just want to take a minute to parse those out. So THC is the psychoactive component. And when you think about marijuana and the high that marijuana produces, or that people might use marijuana for, that is THC having that effect on the brain. CBD, cannabidiol, is non-psychoactive, and there are a lot of kind of the receptors that CBD interacts with are in periphery, so in peripherally outside of the brain. CBD does not produce the high, and when people talk about medical benefit of marijuana, it's primarily CBD that may have an anti-inflammatory effect, may have an impact on pain. So I think it's really important to kind of parse those out. And as I talk about marijuana's impact on the developing brain, I'm going to probably shift to using the term THC so that we can just be very clear about what we're talking about. So as I mentioned, THC interacts with the endogenous cannabinoid system, or the endocannabinoid system. So anandamide is the endogenous cannabinoid neurotransmitter. It's extremely important, and you may have heard that it's involved with the runner's high, and many other brain development features that I have touched on. So THC's chemical structure, you can see here, is similar to the endogenous cannabinoid anandamide, which allows THC to bind to the same receptor that anandamide does, in kind of a lock and key kind of interaction. So marijuana products deliver THC to the brain and to the body, so very rapidly when they are inhaled, and more slowly when THC is in food or drink, as we'll hear that's increasingly how they are presented as products. And THC acts on the CB1 receptor, that's the cannabinoid 1 receptor, that would be normally activated by anandamide. And as I mentioned, the CB1 receptor activation plays a critical role in normal adolescent brain development, and this may be why adolescents have particular vulnerability to the cognitive and addictive effects of marijuana that might be produced by THC. This is a schematic diagram of a simplified synapse, so where two neurons are talking to each other. This is where that might be happening. There are a whole lot more proteins and signaling molecules in a typical synapse, but this is just a simplified version. So this would be THC in the synapses. If you were to take in THC, it goes into the blood, crosses the blood-brain barrier, and enters into the brain, and binds CB1 receptors in the synapse. And this just shows that THC increases dopamine just the same way that other substances increase dopamine to produce the high, and that pleasure that people associate with drugs of abuse, whether it be alcohol, THC, opioids, they all increase dopamine in the reward system. So this is kind of a summary of THC binds to CB1 receptors, and it actually has a stronger and longer effect than anandamide does, the endogenous cannabinoid does at CB1 receptors. So frequent exposure to high-dose THC obscures anandamide selective signaling. So as you might imagine, if there's THC in the synapse, then that THC is going to be interacting with those CB1 receptors preferentially, and the natural signaling of anandamide that is necessary will be interrupted. And so the THC floods the system and obscures the anandamide signaling. that is needed to guide brain development. And in the presence of THC, anandamide can't do its job. And its job is really to balance the neuronal activity that is critical for development. So it really does matter if adolescents are using THC. So I know that Jude Carmichael will touch on this later, but this is just how shows graphically that the component of kind of the THC and CBD levels of marijuana of today, really THC has been increasing over time, and more with commercial products, we are seeing this. And so CBD has stayed low or gone down, and THC has increased because that's what produces the high, and that's kind of sells the product. This graphic is even more recent. This is from 2016, and it shows the THC to CBD ratio, the average THC to CBD ratio. You can see that the ratio average concentration of THC to CBD in DEA specimens by year over time from 1995 to 2014, you can see up to 80 times more THC than CBD. So you're talking about product and the impact on the adolescent brain from adolescents using those products. That is extremely concerning to people who are interacting with adolescents and seeing those negative effects. So the marijuana industry, if you read industry market reports, have said that concentrates, so the highly potent THC products, are a driver of the commercial marijuana market. For someone like me who really cares and studies mental health and substance use disorders and strives to promote behavioral health of adolescents and prevent youth substance use, it's extremely concerning with, you can see this quote here, when we dig deeper, we discovered that one concentrates category is driving a good bit of the growth, and it's vape pens. So if anyone is following trends in adolescent substance use, you know that vape pens and juuling devices are the bane of high school administrator existence right now. And so there's a lot of concern that students, as we see more and more commercialization, will be using highly potent THC products in their vape pens and juul devices. So another, I guess, common misperception that we hear is that marijuana is addictive. The marijuana of 2% THC and the marijuana of 95% THC are two completely different things. And this was a study published in 2015, and it shows the comparison of the addictive potential by drug type. Over here you can see tobacco, nicotine is highly addictive. Again, the vape devices are extremely concerning. Alcohol, here the percent of users who become addicted, looking at a little more than 15%. Cannabis overall, about 10%, and then teens jump up to 1 in 6. And then daily users, particularly daily teen users who are using daily and very often heavy users, that jumps to 25 to 50% of daily teen users. And then this is just how cocaine, stimulants, analgesics, psychedelics, and then heroin is over here. And you can see that daily teen users become addicted at about the same rate as opioid users. So I wanted to pop in a few quotes that I have here from Dr. Eden Evans, who is the founding director of the Center for Addiction at Mass General Hospital. Just some really, I think, great and telling quotes. So, repeated marijuana, THC, really THC use, in adolescence can cause lasting changes in brain function that jeopardize educational, professional, and social achievement. The effects of a drug on individual health are determined not only by biology, but also by its availability and social acceptability. And in this respect, the legal drugs, alcohol and tobacco, account for the greatest burden of disease associated with drugs. Not because they are more dangerous than other drugs, but because their legal status and commercialization causes more widespread use. So I think that that's really important to consider, and this is kind of the graphic representation of that, where this is the number of people graphically represented that use tobacco and alcohol. So approximately 67 million people use tobacco, 167 million people use alcohol. As I showed you, a percentage of each of those substance users will go on to become addicted or dependent or develop a substance use disorder. About 20 million people use marijuana before widespread legalization. So when you're talking about harm or use and use-related harm, when we have this many marijuana users, what does that look like in terms of public health consequences? And I think it's something that we all need to ask ourselves. So this is from the most recent, the 2016 National Survey on Drug Use and Health, showing that there were 15.1 million people with a past year alcohol use disorder out of those 167 million alcohol users, roughly. In 2016, there were approximately 4 million people with a cannabis use disorder, for comparison. So according to the Diagnostic and Statistical Manual of Mental Disorders, which is the most recent edition of that, which is kind of the diagnostic tool and diagnosis codes for mental health disorders, including substance use disorders. The following cannabis-related disorders are listed, and that's because clinicians see them in the clinic. You can see cannabis use disorder there, and then other cannabis-induced disorders include cannabis-induced psychotic disorder, cannabis-induced anxiety disorder, sleep disorder, and then unspecified disorders. So I'm going to kind of switch now into those clinical diagnoses and talk a little bit about the current literature around THC specifically, related risks, I guess I would say. So major national medical societies oppose marijuana legalization because the literature is increasingly showing an increased risk for chronic psychosis, for depression and anxiety, for bipolar disorder, and suicide. Now, when I say it's an increased risk, there's an association, and the literature is increasingly showing this association. We do not yet have information about causation, though I think over time that more and more literature will show that there probably is a causal role, at least for some of these. And I do have citations for all of these, and I can include those in the information that goes out. So in a statement from the National Alliance on Mental Illness, I'm just going to grab this quote as well. There's a growing body of evidence that indicates that smoking or using marijuana increases the risk of psychotic incidents and the risk of ongoing psychotic experiences. The younger and more frequent the use, the greater the risk. And again, another quote from Dr. Eden Evans at MGH Center for Addiction. Kind of tells us that cannabis use is specifically THC use, is a preventable risk factor in the development of psychosis. And this is embedded in a growing body of scientific literature that for those of us who are analysts in substance use and mental health disorders, it's extremely concerning. Absolutely not everyone who uses THC or uses cannabis is going to develop a mental health issue. However, knowing the the tragic consequences and the burden on society, to families, to individuals of mental health disorders. I think there's a lot of concern and growing concern about what the consequences will be, the public health consequences will be of increasing exposure, particularly to high THC products. So as Dr. Evans says, multiple prospective epidemiological studies indicate that use of cannabis increases risk of later psychosis, independent of confounding and intoxication effects. And she says, cannabis is a component, one cause among other factors that contributes to psychiatric illness. She added, however, it is a preventable risk factor, so prevention or delay of onset is important, especially among siblings of schizophrenic patients. So this was one of the first studies to show a link between daily use and specifically daily use, especially of high-potency cannabis, drives the earlier onset of psychosis in cannabis users, and this came out in 2014. And specifically, there are particular genetic vulnerabilities where if people use THC or exposed to THC, particularly when they are adolescents, they are at increased risk for developing psychosis. And that's what these data show here. And these are from scientific studies. They were also pulled from the National Institute of Drug Abuse. It has a really nice summary of this information. They just updated their website actually this month. So this is a genetic variant in the AKT1 signaling molecule, and you can see right here in the green bar, used cannabis every day, and those individuals had almost an 8 times increased risk in developing psychosis. And this is in it's an enzyme actually that breaks down dopamine, the COMT genotype, and this genetic variant also had an increased risk of developing psychosis. So a 2018 study that just came out very recently looked at rates and predictors of conversion to schizophrenia or bipolar disorder following substance-induced psychosis. And what they found, and I'm just going to give this quote, the highest conversion rate was found for cannabis-induced psychosis, with 47% of those diagnosed with a cannabis-induced psychosis converting to either schizophrenia or bipolar disorder. Again, these are very serious mental health issues that I think people are really starting to pay attention to as parents of children who are experiencing these cannabis-induced mental health issues are starting to speak out. And another study, adolescent cannabis use, baseline prodromal symptoms and the risk of psychosis, and this another 2018 study. And the quote from this is, adolescent cannabis use is associated with increased risk of psychosis, even after adjustment for baseline prodromal symptoms, which are symptoms that you would see before psychosis shows itself. So there are a number of what we would call prodromal symptoms, parental psychosis, and other substance use. I wanted to just pull this one up. This is emergency visits related to marijuana use at Colorado hospitals have quadrupled, and this was from the American Academy of Pediatrics conference a year ago. And a quote that the authors said was, adolescents with symptoms of mental illness accounted for a large proportion, 66% of the 3,443 marijuana-related visits during the study period, and that period was 2005 to 2014. And so I think it's extremely important to know that Colorado is seeing an increase in marijuana-related mental health issues among adolescents. An analysis from 2013 showed that youth reporting daily or near daily marijuana use in Vermont reported the highest rate of planned or attempted suicide. So this is usage rate, of marijuana. So what if they had used 20 or more times in the past 30 days, so that's daily or near daily use, they had the highest rates of attempted and blue bar or planned suicide. So this is consistent with what I showed earlier, is that there's from the literature, a 7 times increase in risk of suicide. And this was an analysis by Dr. Christine Miller, who looked at Colorado suicide rates in relation to marijuana commercialization. So 2007 to 2015. There was a boom in medical dispensaries around 2010, and then they voted to legalize recreational in 2012, and recreational marijuana dispensaries opened in about 2014. And this is Colorado's suicide rate per 100,000. You can see it's increased over time. Leading some to ask the question is there an association between the commercialization of marijuana and high THC products in Colorado with their increased suicide? This is here local data from the Metro West Boston area showing that teen marijuana use is associated with an increased risk of mental health issues. And again, we're not saying, can't say at this point whether there's causation or just an association. But those students reporting current marijuana use, which is marijuana use in the past 30 days, had an increased risk of depressive symptoms, self-injury, considered suicide, and attempted suicide. So I talked at the beginning about THC versus CBD, and that the increased risk of mental health issues, particularly with the adolescent and developing brain, was related to THC. And there's some evidence in literature that CBD may be protective to the negative effects on the brain of THC. And so from this Frontiers in Psychiatry article, cannabis is not a safe drug. Depending on how often someone uses, the age of onset, the potency of the cannabis that is used, and someone's individual sensitivity, the recreational use of cannabis may cause permanent psychological disorders. And then they go on to talk about more research is needed to examine the relationship between a possibly harmful effect of THC and a possibly protective effect of CBD. As I mentioned earlier, the products that are available with commercialization are often very high in THC and very low in CBD, which creates cause for concern. So to summarize the information that I've shared so far, marijuana commercialization is associated with higher rates of youth use. And the use of marijuana, particularly regular use of high-potency products, carries significant long-term risks for youth, including, but not limited to, issues with attention, memory, and learning, which I didn't really touch on the cognitive effects of THC on the adolescent brain, though I could spend an entire day on the impacts on academic achievement, cognition, school success at the high school and college level, things like that. Poor educational and life outcomes, reduced IQ for persistent heavy users, the potential for addiction to marijuana, increased risk of addiction to other drugs, and increased risk of psychosis and possibly suicide. I want to just touch briefly on marijuana and the opioid epidemic, because I think people are often saying now that if we loosen our marijuana laws, it will help the opioid epidemic, and I think that isn't necessarily borne out when you dial down and look at the data. And it does depend on what data you're looking at, whether you're looking at, prescription, what's happening with prescription drugs, what's happening with opioids. But commercial marijuana is not a solution to the opioid epidemic, and that came from a quote from some researchers here in Boston. But this is just data looking at opioid deaths in Colorado, unfortunately, what's happened over time, comparing that with marijuana policy. So medicalized marijuana here, then medical was commercialized during this time period, and then fully legalized marijuana is here. And they have continued to see an increase in opioid deaths over that time period, unfortunately. And this again was an April 2018 article that was published by Dr. Nick Chatty and Dr. Sharon Levy. And the title was, "Easing Access to Marijuana is Not a Way to Solve the Opioid Epidemic." And I just wanted to kind of read some quotes from them as to why they are saying that. And they are adolescent addiction medicine specialists at Boston Children's Hospital here in Boston. Public health efforts inevitably involve trade-offs, but interventions that are broadly disseminated must have minimal harms. There is ample evidence that individuals, especially adolescents, who use marijuana have much higher rates of mood, anxiety, and psychotic disorders than their peers. The loss of motivation that we see in so many of our patients who use marijuana, its negative impact on functioning at school or at work, and its likely connection with cognitive decline are other serious and common harms. Adolescents who use marijuana are also more likely to misuse prescription opioid medications. In our experience, nearly all of our patients with opioid addiction first used marijuana heavily. So just something to think about. You know, I'm not saying one way or another, but I think, again, it's the adolescent addiction medicine specialists who are often kind of drawing attention to what they're seeing in the clinic. So it's my belief that we must prioritize behavioral health promotion and prevention to achieve an addiction-free future. And I recently had a middle school student say, if people make money off of selling addictive products, will addiction ever end? And I have 3 young children, and the officer standing next to me said, nope, will never end. And I said, no, don't say that. I said to them, there were 200 8th grade students, and I said, an addiction-free future lies with you. You all have a choice. You can support the industries that are making money off of addictive products, or you can choose not to use, and you can protect your brain and stay healthy. And so I believe that behavioral health promotion and prevention are absolutely critical to an addiction-free future and to solving the opioid epidemic. So that really brings me to positive youth development. Now, I believe positive youth development is absolutely critical. This is the social ecological model in the spheres of influence for effective prevention, and it shows societal and community, and I touched on these earlier. This is a really cultural norms, societal norms, public policy at the national level, at the community level, schools, youth-serving organizations, and then the relationship sphere of influence is peers, family, the kind of those really close relationships that are absolutely important for positive youth development. And then the individual, which is history, personal history, and a biological kind of risk and susceptibility. I believe that we all have a role to play early and often in positive youth development. And here in the relationship ring and as a parent, I believe that prevention starts at birth, and that it is never too early for parents, a community to rally around positive youth development, for parents to talk to pediatricians, and for pediatricians to talk to parents. These are, people call addiction a pediatric disease because it has its roots in early substance use. And if we prevent early substance use, we do have hope for an addiction-free future. That's it. Thank you.